Hello, Dr. Berg here. We're going to talk about lactose intolerance, okay? A lot of people have this and they don't even know they have it. And some people think they have it, but they don't really have it. So let's talk about that. Lactose intolerance is a situation where you can't break down lactose. That is milk sugar. And there are dairy products that you can buy that says lactose-free. But here are the symptoms: gas, bloating, inflammation, pain in the abdomen, pretty much right after you eat, or it could be delayed several minutes, rumbling in the intestines. Sometimes a lactose intolerance occurs lower in the small intestine, so it takes maybe even an hour to kind of get down there until you react. So it's not always immediate, okay? But the point is, these are the symptoms. So you have to differentiate, is it a lactose intolerance issue or is it a milk allergy? Two separate things. An allergy is an allergy to a reaction to the protein in milk, which is casein. It has nothing to do with the milk sugar. So if you consume lactose-free products, dairy products, and you still have a reaction, it could be you have a milk allergy. The best thing to do is go get tested and just see if you have a lactose intolerance or is it an allergy to milk. And especially if you're reacting to milk and you're eating it and you get pain. Now, why do you have a lactose intolerance problem? Well, it could be several reasons. It could be previous damage to your intestinal lining. Let's say, for example, in the past you had a lot of antibiotics. Let's say in the past you were given vaccinations that threw off your system. Let's say you were raised on pasteurized commercial milk with all the different hormones and chemicals, and your body started developing resistance. Let's say you have a loss of your immune system for some reason, like a huge stress event, and you start getting an autoimmune disorder, and that made you your immune system weak. So there's a lot of different things, and even as you age, you develop a resistance or an intolerance to lactose because really you're lacking the enzyme lactase to be able to break down lactose. And it can happen on a gradient scale where you're a little bit lactose intolerant and then it's more and more severe. Okay? All right, so what do you do about it? You want to get a good probiotic so you can start building up your flora, your intestinal bacteria, so those little guys can start making the enzyme lactase to digest lactose. The one that you want to get when you read the label, the type of microbe would be Bifidobacterium longum. Okay, so I'll write that down below if you want to get the exact spelling. Because those little guys will start making lactase, which is the enzyme to break down lactose. Now, the other thing about what to avoid if you're lactose intolerant is you want to avoid processed cheeses, cheese or milk itself, yogurt, and cottage cheese, because those are the milk products that have high sugar. Now, anytime you read the label and it says sugar, you can be pretty much guaranteed that that is the amount of lactose in the product, okay? So just look at the sugar. So processed cheese, for example, has 19 grams of sugar. That means you have 19 grams of lactose. That's a lot of lactose. You're going to react pretty bad on that product. Milk, 12 grams. Yogurt, 10 grams. Cottage cheese, 6 grams of sugar. That's all lactose. But when you get into cheese, like aging cheeses, like cheddar or Swiss, that is zero. Well, it's like 0.5 to 0.3 to sometimes 0 grams of sugar or 0 grams of lactose. So just read the label. I mean, if you really want to be safe, just get it 0. But sometimes even a small amount of lactose or milk sugar is not going to be a problem. All right? So thanks for watching. Go ahead and apply this and put your comments below. Hey, you probably already subscribed, but if you haven't, press this little button down below and I will keep you updated.